But the big story today, anyone violating the two-child policy in Uttar Pradesh will be barred from contesting local body polls, from applying for or getting a promotion in government jobs, and even receiving any kind of government subsidy. These are some of the proposals mentioned under the draft Uttar Pradesh Population Control Bill 2021. As per the draft bill, the government will introduce a compulsory subject related to population control in all secondary schools. Justifying the proposals, the draft bill says, and I'm quoting here, in Uttar Pradesh, there are the limited ecological and economic resources at hand. It is necessary and urgent that the provisions of basic necessities of human life, including affordable food, safe drinking water, decent housing, access to quality education, economic livelihood opportunities, power, electricity for domestic consumption, and a secure living, is accessible to all citizens.
हमारा जो टाइटल है वो कंट्रोल, स्टेबलाइजेशन एंड वेलफेयर है। तो इसमें हमने ये प्रस्ताव किया है कि जो व्यक्ति, जो दंपति 2 बच्चों की जनसंख्या नीति को अपनाता है, उसे तमाम प्रकार की सरकारी सुविधाएं दी जाएंगी। उसकी जितनी भी राज्य की कल्याणकारी योजनाएं हैं उनका लाभ दिया जाएगा। और अगर कोई व्यक्ति इस नीति का पालन नहीं करता है तो फिर वो राज्य की कल्याणकारी सुविधाओं का लाभ पाने का अधिकारी नहीं होगा। और इसमें हमने ये भी प्रस्तावित किया है कि अगर ऐसा व्यक्ति जनसंख्या नीति को नहीं अपनाता है तो उसका राशन कार्ड 4 यूनिट तक सीमित कर दिया जाए।
आज की आवश्यकता है कि जनसंख्या नीति आ जाए और सब लोग जिस प्रकार से देश के सामने चुनौतियां खड़ी हो रही हैं उसका मिल करके मुकाबला करें।
जिस जनसंख्या के भरोसे, जिस जनसंख्या को देखकर आपकी बाछें खिल जाती है जब आप वोट मांगते हैं, वही जनसंख्या आपके लिए अभिशाप बन गई है। और अभिशाप इसलिए बन गई है क्योंकि हमारे डेमोग्राफिक डिविडेंड को, जो जनसंख्या हमारा सबसे पुरजोर हथियार था, हम सबसे युवा राष्ट्र हैं दुनिया के, हमारे यहाँ सबसे ज्यादा वर्किंग क्लास पॉपुलेशन है, हमारे देश की जनसंख्या को देखकर यहाँ बड़े बड़े लोग निवेश करने को तैयार रहते हैं, कंजम्पशन यहाँ का बड़ा है। अब वही जनसंख्या को आपने अभिशाप बना दिया है।
So, controlling and stabilizing the population of the state is necessary to promote sustainable development with more equitable distribution, the bill says. But is this the solution? Those with over 2 kids can't contest local polls, apply for government jobs or get any subsidies. Is this the solution, or will measures such as these only discriminate against the poor and the socially marginalized? Joining us on Left, Right and Centre tonight, Dr. Sujit Singh Dang, BJP leader, former UP minister, Ghanshyam Tiwari, spokesperson of the SP, Sudhendra Bhadoria, national spokesperson of the BSP, and Poonam Mutreja, executive director of the Population Foundation of India. Poonam Mutreja, I want to get to this right away. We don't have much time on this discussion. Those with over 2 children can't contest local polls, apply for jobs. Won't this impact women the most? Most women don't even have control over how many kids they can have. And after this, you can't get subsidies, you can't contest. Won't this isolate them further, push them further into poverty?
Totally, you're so right. It is anti-women, it is anti-poor, it is anti those women who do not have either rights or access to family planning. Women in India do not wish to have more than 2 children. So if they're talking about to make it equitable, it is the most inequitable thing we could do. It defies all the data that exists. It defies the studies that were done by Nirmala Butt, former Chief Secretary, Madhya Pradesh, when the 2-child norm was introduced in several states amongst the panchayats in India. Women got divorced on paper by their husbands. Families gave children for adoption. I cannot, apart from it defies data, there is no evidence, but there is bad evidence. And we not only have bad evidence in India, if you look at Nirmala Butt's study, but look at China. China gave up the 1-child norm, then the 2-child norm, and 3-child norm.
And now they're back to 3-child norm.
Recently, they've introduced the 3-child norm. We need to learn what not to do from China. Sex ratios, girls, forget women. Apart from women being discriminated against, we are going to see huge sex selection. UP already has very high sex selection. We are going to see a much greater sex selection and abortion happening of the unwanted girl child, not the boy child.
Yes.
And even if you see the incentives and disincentives given here, They have given such amazing incentives. It should be given to people in any case, like 12 months paternity leave. I welcome that, but not as an incentive to only one father. Secondly, how can you take away rations for the third child who's going to be born into the family? It violates the.
What if you have another pandemic?
Exactly, and during the pandemic, I mean, is this timing? But there is no good timing to do these coercive measures. Look at how 24 states in India have reached replacement level fertility, and all those 24 states, we have something to learn from. Let's learn from also Indonesia and Bangladesh, where fertility came down rapidly because they invested in education. They give a basket of choice of family planning services.
Dr. Dang, has this really been thought of? You know, you often hear of these policies made by male policymakers. Women not really taking these decisions at all on these panels. I'm not sure if that's the case here, but population explosion is a genuine problem. It puts pressure on all resources, jobs, food, etc. It's not an easy solution for any government, but is this the solution? Have you thought about what impact it will have in a country like India, given our history when it comes to female feticide, etc.?
I am grateful to you that you have tried to understand the whole problem in total. See, anybody with a little grey matter knows that if there is a population explosion, and in a state which is the largest state in India as far as the population is concerned, and this explosion takes place, the nature has limited resources. Arable, non-arable land is limited. Drinking water is limited.
Nobody is debating that, sir.
Food grain is limited. So there has to be put somewhere, if not full stop, a comma has to be put up there. A semicolon has to be put up there. And this is a very wise decision, because there are people. Now, I don't know how Mutrija ji, I have a lot of respect for her. How does she say that if we don't do it and let the population explode, see, it will be good for poor people?
No,
that means she is
I don't think
population.
you said that, sir.
And look, I'm just trying to give you a historical fact.
So she's not saying that.
In emergency, what happened? We don't go for that.
My question to you, Dr. Dang, are there better ways to bring down population? What about education? We've spent decades not educating the public, not promoting contraception. Now you want to penalize people?
This is a draft bill, not an act. This is a draft bill.
Ghanshyam Tiwari,
this is
not focusing on education, not focusing on providing contraception, now penalizing people. Is this the easy way out? Where does your party stand on this, the SP?
The party stand is very clear.
Dr. Dang, 1 second. Dr. Dang, 1 second.
Okay.
Good evening to every one of your viewers, my fellow panelists, and you, Sarah. I think I want to say 3 things, but before that, I want to state my regret for the kind of violence Uttar Pradesh saw district after district. Journalists attacked, women attacked by goons of BJP with grenades and guns. As far as population, civilization is concerned, India has had the longest experience. Starting in 1952, we were one of the first countries to initiate policy of family planning. National Population Policy 76, Revised Population Policy 77, Health Policy 83, Committee on Population Education 91, Draft National Policy 93, and National Population Policy 2000. So we have a track record, we have a body of knowledge. There is wide consensus internationally and even in India that girl education, particularly beyond class 10th, 12th and above, and female labor force participation are 2 sure short ways to ensure that population stabilizes. You cannot have a male-led body determine how many children would women have, and especially at a time when there is tremendous opportunity we as a country have to educate every girl in the country. But when you look at BJP states today, and in general BJP polity, or the politics of BJP, the way it has played out in Uttar Pradesh today, that women are continuously disincentivized from workforce. Their female literacy, they haven't done enough. With online education, the digital device penetration among women is falling. My final point is, Uttar Pradesh cannot be the role maker, the champion of women policies. There's not a single point on their manifesto of 2017, and I can read it for you, that they have fulfilled. This is what they promised. As far as their ways of lawmaking is concerned, the foundation is propaganda. Look at the way they implemented Love Jihad Act. The governor of Uttar Pradesh, is a woman, said that if the government has brought that policy, they would have done some survey. But that statement was hollow because the government had not done any survey. So if the foundation of a policy is built around propaganda, it is not directed on the knowledge base that India has, and it is not using the most important and pertinent research. This population bill, you showed the bites. There is no foundation of research, not a Niti Aayog research paper that says that these incentives will lead to population stabilization. If they are putting something on the table, they expect the nation to follow. Let them put out some research. Let them put out the research of Niti Aayog. Let them put out the research of RSS. But that does not exist. Only the propaganda exists.
All right. I want to also get in Surendra Bhadoria before I come back to you, Dr. Dang. You know, again, the big picture, whether or not this is, you know, a communal dog whistle also, but the big picture, we haven't educated our women. We don't have sex education in our schools, in our curriculum. We don't promote contraceptive use. And look at the statements we get from our ministers. We also had that BJP MP, Sakshi Maharaj, saying Hindu women should have 5 kids. So complete confusion in the midst of a pandemic, when you have a digital divide where more women, young girls are being pulled out of schools. Now we have policies like this. Where does your party stand on this, Mr. Bhadoria? I ask this both of you and Ghanshyam Tiwari because this government claims they're open to ideas, they're open to criticism, they're open to suggestions. So we want to ask, what will you as opposition parties in the state be doing about this? Mr. Bhadoria.
Let me put this debate in perspective in the context of the population increase which the BJP is espousing to tackle. The population increase is not just because of the desire of some people, it is also because there are certain indicators which are when there is more unemployment, when there is more illiteracy, when there is more poverty, when there is more hunger. You look at the nation states and social groups where there is more population growth, it is because of the factors which are related to development, and there are n number of studies available across the globe, in India and abroad as well. So therefore I would put it across to you and also the other panelists in this discussion that please don't use coercion. If you want to tackle this, please resolve the issue of unemployment, the hunger and poverty, and give education to all. The moment you do this, which has been done in Kerala, you will see a different kind of population growth taking place in Uttar Pradesh. So rather than trying to resolve the issue through the right method, they are going at the time of elections. And I tell you, I have a feeling and a fear that it has some other meaning and other kind of motive, and that is to create again a religious divide and use it electorally in the context of the coming elections of 2022.
All right. Well, the question is, what will your party, what will Ghanshyam Tiwari's party, what will the SP and the BSP do about this on the ground in terms of raising your voices? But thank you all for touching upon lots of issues on this subject. It's extremely critical. We're just emerging out of a pandemic where we've seen unemployment rise, we've seen education, lack of education also on the increase. Should we now be looking at childbearing, child rearing, focusing on improving social indices like literacy, healthcare, especially women and children, family planning measures, including the promotion of modern contraceptives instead? That's the question we leave you with tonight. Meanwhile, let's just give you the big picture when it comes to our fight against the spread of the coronavirus. India has added 42,766 new COVID cases in the last 24 hours. That's slightly lower than yesterday's 43,393, cases. And Kerala now leads the states with the most number of cases in a day. Kerala, with 13,563 fresh COVID cases, leads the states in the most number of infections over a 24-hour period. It's followed by Maharashtra, way back at about 8,000, Tamil Nadu at around 3,000, Karnataka at around 2,000. And I spoke earlier to the person at the helm of the state's fight against the spread of the coronavirus, Kerala's health minister. Here's our chat. Thank you for your time, ma'am. We know you're extremely busy. Kerala has a large vaccine footprint. Yet at the same time, infections in Kerala are rising, adding to India's overall COVID caseload. Now reports that Kerala accounts for 30% of India's daily COVID tally. How do you explain this paradox, ma'am?
We are going through the second wave of the pandemic, and we had our peak on May 12th. And the second wave started in our state on by the middle of April. And on May 12th, we had the maximum number of positive cases on a single day, and that was around 43,500. And then it went on decreasing, and now it's around 10,000. And now we are having a plateau, and it is quite expected in our strategy of defeating or in facing the COVID, because we have developed such a strategy that we have always tried to keep the number of cases beyond, that is below the medical capacity threshold. So as you all know, in Kerala, we didn't have a case where any of the patients, he or she died without getting oxygen or without getting ICU beds or without getting ventilators or anything. So our strategy was always to keep the number of patients below the healthcare capacity threshold. So we are going on like that. So this plateauing of the wave is quite expected in this phase of the second wave, and we are trying our best to decrease the TPR and also the number of positive cases.
So this is all part of the plan. This is what was expected. This is a plateau, not a peak. You're absolutely right, ma'am. Kerala stood out as one of those states where you weren't hearing those horrific reports of people dying outside hospitals without a bed, without oxygen. And certainly the overall death toll due to COVID was amongst the lowest in the state of Kerala. But how do you explain, ma'am, the continuing high positivity rate right now? We're finding Kerala reporting almost 13 infections per 100 tests. States like UP, for example, somehow this figure is under 3, I think.
Yeah, our test positivity rate is around 10, and today it's the 3 days average is 10.5%. Okay. And what we do is that if a person is found positive, we do the tracing like that. That is, we find his primary contacts, the secondary contacts, and the tertiary contacts, and we conduct tests. So what we do is we do the targeted test, not random testing, we do targeted test. So out of the 50 people who are in the contact of the first person, there is possibility that more persons will be positive. So we are ensuring that no one who is who is infected from the first person is going without getting reported. So in Kerala, we ensure that also the seroprevalence study we have conducted earlier, it shows that only 11% of the total population was infected, and also we report 1 case out of 3. That's if 3 persons are positive, 1 is definitely reported. So that is our strategy. That is also a part of our plan. So we are focusing on targeted tests. So we believe that that will help reducing the spread of the virus.
So if you do targeted testing as opposed to random testing, this is only to be expected, is what you're saying. There is also a concern across India about the fact that our vaccination rates are now starting to fall. In fact, we've seen a huge fall between yesterday's vaccination numbers and today's 10 lakh difference between the two. Where does Kerala stand in terms of vaccinations? Do you have enough supply, and is it enough? The rate of vaccinations in Kerala, is that enough to stave off a third wave?
So in Kerala, we have more susceptible persons. As I said just now, the seroprevalence study shows that only 11%, now it might have increased to some 20% or 21%. And again, still then the number of susceptible persons in Kerala is very high when we compare it to the other parts of the country. Yes. So the only way before us is to vaccinate our people. We have developed a very good system in our state to vaccinate the people, and daily we can vaccinate more than 2.5 lakhs people, and some days we have went up to 3 lakhs vaccinations a day. But we have put our request before the central government to give us more vaccine. Our request is to give us vaccine according to the percentage of the susceptible persons and not according to the percentage of population. So we have written letters to the health ministry, and also...
What is the response you've gotten, ma'am?
Sorry?
What is the response you've gotten? Because you're making a very important point here. You're saying the state of Kerala has a higher percentage of more vulnerable persons to the coronavirus, and hence you believe that Kerala should perhaps be given more of a priority, or at least the supply to Kerala of vaccines should flow freely.
Yeah, definitely, because we have zero wastage of vaccine, and also we have negative wastage of vaccine. If we can vaccinate from one vial, if we can vaccinate 10 persons in Kerala without any loss, we are doing it in 11 persons. We are vaccinating 11 persons. So our request is to give us more vaccine according to the number of our susceptible persons, and we are looking forward, and we hope that they will consider our request.
Have you heard back from the center? Any response to your request?
We are looking forward, and we have asked the central government to give us more vaccine, and anyway we are looking forward. Hopefully they will be providing us more vaccine.
All right. Ma'am, though you know, the Prime Minister has voiced concern at the persistently high number of coronavirus cases coming from the states of Maharashtra and Kerala. Meanwhile, this week we've seen signs of life limping back to normalcy. Kerala eased up on restrictions this week on Thursday. The Transport Minister has said that the KSRTC is ready to start interstate services. Across the country, we're seeing visuals of Indians thronging, going to tourist sites, etc. Is this not a concern for you? Are these cases similarly in Kerala also not high or increasing because of the opening up?
See, this was a case in the first wave also, because while in other parts of the state, when they were unlocked from the first wave by September 2020, we were having our cases in the first wave in October, November, December, January, etc. So we slowly started, and we tracked the wave. We tried to track the wave, and so in our state, we have many other challenges. The senior citizen population the percentage is very high, and also the number of diabetes patients is very high in our state. And also one more thing is there, it's the population density. And as you know, it's double that of the national average. So these were the challenges when we developed our system, and these are the challenges now we are facing. So we are trying to drag the curve. We try to delay the peak, and now we are trying to drag the curve.
All right. And ma'am, the key factor that epidemiologists track and that has everyone worried is the R factor, right? At 0.92. What is the R factor in Kerala? Is it not above that danger mark of 1.0?
No, in some districts it's around 1.12 or something, but we are closely monitoring. And another variant, Delta Plus, was found in 3 places in 2 districts. And so we are closely monitoring, and we are categorizing the local bodies according to the TPR, like now it's 5, 10, 15, 20, etc. So those local bodies which are having a TPR about 20, we enforce triple lockdown in those local bodies, and in from 15 to 20 it's lockdown, and like that. So we are enforcing strict restrictions, and also people in our state, they are cooperating with all these measures, and they are wearing the mask, and they are trying to obey or observe all these decisions taken by the state.
Ma'am, I would attest to that. I traveled to Kerala, I think 2 months ago, and I was completely surprised with the operation underway at the airport, the systems in place. It really was amazing. But of course, leadership is tested, truly tested in a time of a crisis. And right now, Kerala is battling a war on 2 fronts. You also have the coronavirus fight, and in the midst of this, now hearing reports of Zika, and the center has sent a 6-member team to monitor the Zika virus situation in your state.
Yeah, thank you for your good words. And about Zika, the first case was reported in a 24-year-old woman, and she was pregnant. She came to the city for her delivery, and she delivered a baby, and both the mother and baby, they are keeping good. And 19 more samples were sent to NID Pune, and out of those 19 samples, 13 were found positive. And again, we sent 14 samples, and all those 14 samples were found negative. So now everything is under control. We have intensified the vector control activities, and also with the coordination of all the departments and the district administrations. And we are focusing on surveillance of pregnant women. As you know, if the Zika virus or the Zika virus disease, it may cause some defects to the babies, and so we are focusing on surveillance of pregnant women, and we have asked all our medical officers to do tests for Zika in all pregnant women who have fever or Zika-like symptoms.
Veena George, the person in the hot seat in Kerala, thank you for your time and clarifying all of that. Thank you.